Okay, so so good morning, everyone. I'm pleased to be here today to talk about a pilot study that's been funded by MASI that explores how women in prison have been able to remain connected to family and services during the COVID pandemic. So before I go into it, I wanted to give a kind of brief introduction to the team. There's four of us working on the project. There's myself as PI, and I'm a research officer in psychology working on a study that examines the impact of COVID restrictions on prisoners and staff. The co-I, Dr. Aduna Shea-Beckley, is the research and evaluation lead at Eastwood Park Prison and the counselling psychologist there. And that's a women's prison in Gloucestershire. We have Rachel Dagnall, who's a forensic psychologist and senior lecturer from the University of Lincoln, and she's come on board as a qualitative expert to help guide the project. Finally, we have Danielle George, who is the research assistant employed on the project. Danny's a PhD student in psychology and assistant psychologist too. So the idea behind the project, which I will introduce in a moment, really came from talking to people who work in the criminal justice service and the Welsh Government to ask them what their research priorities were. So I asked people, what do you wish you knew, or what would be helpful to you in your role? And is there something that we can do together to kind of meet those needs? And I had some really interesting conversations with people from a variety of roles, but I really drew out kind of four themes, I suppose, from the conversation, which not surprisingly centred a lot around COVID, the response from COVID, and what we can learn from that to improve services. And people really wanted to know, how can I support prisoners during restriction periods? So when we were at the height of COVID restrictions and lockdown, prisoners spent up to 23 hours a day in their cells. All visits were stopped. The regime, the services that support them during their time in prison all stopped. And staff wanted to know, how can I continue supporting prisoners during these restrictions? How can I do my job to the best of my ability? Secondly, they wanted to know, how has the prison response impacted relationships between prisoners and their families? So as I said, visits to prisons were stopped and families didn't have that contact for quite a long time. After a while, video conferencing facilities were introduced, which were welcomed, but they didn't come without their challenges. You know, a lot of the time, because of security, if there was movement behind the scenes, the connection would drop. So you can imagine parents speaking to children, small children, and they can't keep them still, or even an animal walking kind of past the screen. It would mean the connection would drop, and that kind of meaningful contact was lost. So staff wanted to know, you know, what's the impact of that on prisoners and their families, and how can we support them? Linked then to that was what more can be done to ensure prisoners have access to support services. So this was particularly important for professionals working with female offenders, particularly those in Wales, because at the moment, there are no services at any level of custody for women in Wales. There are no prisons, there are no approved premises, which basically are establishments that house and monitor ex-prisoners in the community. But what we do have is, for a certain subgroup of high-risk offenders, is a transition service that supports women who are resettling back into the community who've been in prison. But they couldn't access prisoners, or they struggle to gain access to the prisons during restrictions. And they wanted to know, what more can be done to support women in this way? And finally, there was really a kind of an overarching theme of wanting to learn from the response in terms of helping prisoners maintain contact with families and services in the long term. So a lot of prisoners are placed far away from families during their sentences, not just women, young people, people in the male estate, for various reasons. And COVID has really provided an opportunity to explore how we might overcome these challenges in the long term. And then MASI came along, and I thought the theme for MASI fitted really well with some of the research priorities that I've been discussing. So the theme for MASI was preciousness of life, hope, change, renewal. And I think really at the core of some of the conversations that I was having, you know, what was it that we were talking about? It was connections, it was contact with people, it was linking the inside to the outside, connecting through technology, and how we can kind of encourage and promote that, what we can do to support, you know, to encourage prisoners to access the right kind of support for them. And for a group of people, prisoners who kind of already face challenges of hope and renewal anyway. So the pilot study looks at the impact of the prison COVID response on prisoners' ability to maintain and enhance their support network. And the main aim of the project is to consider what means of communication best link the inside to the outside, how staff have overcome barriers to connectedness caused by the prison response, and the potential consequences and benefits of the response, to offer recommendations to support connectedness in the long term in custody and when transitioning back into the community. And we're looking at this point, we're looking at this from the perspective of staff who work in the female justice service. Now there's a lack of research that examines the kind of dynamics of connectedness from their point of view, but staff, you know, are really central to supporting prisoners maintain contact. So we're exploring this in the first instance from within the female estate, because there have been some very important distinct gendered consequences of the restrictions from COVID globally, both in prison and in the community. Now, women in prison tend to continue being the primary carers for children when they're incarcerated. And the suspension of the face-to-face visits has been found to diminish the kind of their opportunity to parent, which can harm the family relationships, disrupt the family life, which will have long-term implications on family reunification and resettlement of individuals after they leave prison, which is really important because contact with family is one of the most important factors for reducing reoffending in women. A digital divide around virtual methods of contact have also been reported for women transitioning from prison back into the community during the pandemic, due mainly to a kind of lack of digital literacy skills, which then, you know, it limits their ability to access support services and families unless they've got the support and the assistance from prison staff to help them do that. So specifically within the UK, because the studies that are out there at the moment are primarily global, there is a lack of research in the UK that examines this kind of gender divide within the criminal justice service, particularly in community settings, which again is really important because one of the kind of main mitigating strategies for the prison COVID response included early release strategies. But we don't know yet. It's unclear whether there was any kind of unintended consequences on how they were able to connect with the people that they needed to support them as they reintegrated back into this kind of pandemic world. So we are using a subgroup from within the offender personalities disorders pathway as a case study. The OPDP pathway, it's called, is for those with personality difficulties and individuals who have kind of complex psychosocial needs. And they are more likely to kind of react acutely to these environmental and procedural changes that occurred because of COVID-19. So we have recruited staff from a variety of groups across the criminal justice service. We've recruited people from within health. So we have the Women's OPD transition team who help women transition out of prison back into the community here in Wales. We've got different staff groups within prisons. We've got in-reach workers and prison staff. We've got probation staff from approved premises, which are those houses that monitor and support ex-prisoners. And we've also got individuals from the Prison Advice and Care Trust. So these are social workers and support staff for prisoners and for families. And we're just waiting for, so we've had kind of management approval, and we're just waiting for it to go through the kind of internal processes there. So we've had a lot of support from HMPPS, particularly kind of more recently. It's started to really grow, and that's kind of helped with the recruitment. Because sites are being told about the research and they want to be part of it. The study's been endorsed by the Directorate Lead Psychologist for HMPPS in Wales. He's helped with recruitment and with dissemination. It's also been supported by the Assistant Chief Probation Officer from Wales. So they're supporting recruitment and also networking with the implementation team within the female offender policy framework. The policy framework is a blueprint for kind of transforming female offending and youth justice services in Wales, and it involves partnerships between Welsh Government, UK Government, policing in Wales, and justice partners. So it's really exciting to be part of that, and also the kind of more local pathway within Wales have agreed to kind of support and with recruitment and dissemination. So we've been really lucky there. So why is this research important? Well, it very much addresses some of the key priority areas from these documents and papers. So there's an area of interest document within the Ministry of Justice that outlines key kind of research priorities. There's the prison strategy white paper, the women's policy framework that I just mentioned, and there's also kind of operational benefit. So the study, I think, really has the potential to consider how alternative approaches to in-prison visits, so things like video conferencing, telephones, letter writing, impacted prisoner well-being and their ability to maintain those social bonds that are so important during restriction periods. And we will also consider the impact of that from families and also on staff roles, including kind of workload management when they were kind of attempting to support residents, to support prisoners maintain that contact. We also aim to consider how the prison response impacted prisoners' ability to kind of interact with external services that facilitate that kind of pathway through the criminal justice service, so from prison to community, for those living in the female estate. The project also offers scope for learning and an improved kind of prison regime towards rehabilitation and a trauma-informed approach. So those living in the female justice system often present with distinct and complex needs, and involvement in the system generally can lead to challenges maintaining those social bonds, connections with family, children and others, and that's seen kind of more acutely within the female estate, which can cause adverse outcomes not just for them but also for their families. And we will also be examining how they were supported during their resettlement back into the community. So operationally, I think learning from the COVID response can be used to prepare for any future outbreaks that happen, but also to kind of understand the key factors that support those living in the female estate engage with their support networks beyond COVID-19. As I said, this is particularly important for those living in Wales because of the lack of services here, but also the wider prison population. You know, it's not uncommon for prisoners from all areas to be sent to different parts of the country. Could be due to the sentence type or the type of treatment that they need, where they may not then be able to see family anyway. They might not be able to travel to the other end of the country. So it's relevant in the long term. And the pilot aligns with the current national impact evaluation that's being supported by the Offender Personality Disorders Pathway Central Team, and it's funded by the ESRC, that aims to understand the effect of COVID-19 management and environment on wellbeing and harm in prisons. And that's a project that I'm working on at the moment. And we are looking at that from prisoners and staff perspectives too. And I also hope to kind of link in with, there's been an evaluation done by the National Offender Management Service on Purple Visits, which Purple Visits is the name of the video conferencing service that's used within the prison service. They've evaluated that, and I think that this work here would also be helpful and would complement that. So I don't have any results to present to you today because the interviews are being conducted at the moment, but I thought it would be useful to summarise some of the challenges of setting up research of this nature. So this is a visual representation of the approval processes that we have had to go through for the different staffing groups. So the OPD pathway is a complicated one because it's a joint initiative between NHS England and HMPPS. So they have a mix of staff. So they have mental health nurses, psychologists, prison officers, and that's made it very kind of complex navigating the approval processes across the services. Now, when you do prison of any nature, research of any nature within prison and probation, you have to get approval from the National Research Council. And research involved in the NHS might involve approval from the Health Research Authority. Now, the complication is some of the participant groups that we have included cross over between the two. So they might be based in prison or based in probation, but employed by the NHS. So you need approval from both camps. But they might have different perceptions of what's classified as research. So I've also had to go through additional processes because of that and get approval from the Joint Scientific Research Committee within the NHS. Now it's been really helpful because they've provided some useful recommendations, and also they've linked me in with the individuals I mentioned earlier from within HMPPS. So that's been all positive, but it is very time consuming. And something that you do need to consider when developing research like this. And even once you've had the approvals, you then have to go, you can't proceed until you get the green light from the prison governor, the health board, or from the management. And additionally, we've got participants from the third sector who are based but not employed within HMPPS, and they also have their own systems. So it's been a massive learning curve, and one that has caused some significant delays. But also, to take the positives from it, it's certainly going to make any additional work or studies linked to this easier to manage. I will know in terms of knowing who to speak to, what you need to do, what you don't need to do, and I think also we've got some kind of clear recommendations to make where we link in HMPPS and NHS within this group. But if anyone else is doing research of this nature, I would be happy to have a chat and talk through some of the processes and the learning points that I've had the last few months. So to finish off with some future considerations, the goal is to write a stakeholder report for HMPPS with outcomes and recommendations, as well as an article for peer review. But fundamentally, the kind of main goal is to use the findings from the pilot to inform a larger grant that explores this across the wider criminal justice service. So people in the male estate, young offenders, and also to capture the perspective of prisoners. And we hope it leads to further collaboration and generation of ideas that can be translated into practice and help both the staffing group and also the prisoners. So I'll be happy to have any discussions or answer any questions anyone might have at this point.